Let's get one thing straight right out of the gate, folks. If your entire worldview on modern pharmacology comes from daytime talk shows, glossy magazine spreads, or whatever newly ordained influencer is currently lip-syncing trying to get affiliate commissions, you probably think GLP-1 receptor agonists are nothing more than chemical vanity injections. Expensive little pens designed exclusively to help Aunt Mildred squeeze into her size 6 cabana wear before a 2-week cruise to Cabo. This could not be further from the truth. Mainstream media loves a shallow narrative. They adore reducing a monumental shift in cellular biology down to a Hollywood red carpet gossip column. To them, these compounds are just skinny shots, magical hunger erasers for people who lack the willpower to put down the double bacon cheeseburger. As a clinician who has spent decades digging past the superficial grease of standard medical dogma, let me give you a hard dose of reality. Calling a third-generation triple agonist like Retatrutide a weight loss drug is like calling a Ferrari a commuter vehicle to pick up groceries at the local strip mall. Technically true, but you are completely missing the point of what is under the hood. If you are looking for advanced guidance tailored to your unique biochemistry, explore our specialized programs like peptide therapy in Sarasota or our comprehensive semaglutide protocols in Sarasota. But before you jump on the bandwagon, let's look at why the longevity world is obsessing over these molecules and why your primary care doctor, bless their overworked, insurance-dictated soul, is still stuck in the dark ages of caloric restriction lectures. To understand why next-generation therapeutics are turning the longevity paradigm upside down, we have to look at how far we've evolved past the blunt instrument pharmaceuticals of yesterday. Medicine used to love sledgehammers. If a patient was metabolically broken, standard practice dictated handing them a prescription for a synthetic hormone or a generic insulin pusher, patting them on the head and telling them to eat less and walk more. It's the nutritional equivalent of telling someone whose house is on fire to use a garden mister. Then came the incremental climb of incretin science. Let's break down the evolutionary ladder without putting you to sleep. The evolution of weight loss medications can be understood in 3 generations, each adding new metabolic mechanisms to improve effectiveness. The first generation, semaglutide, Ozempic/Wegovy, targets the GLP-1 receptor, promoting satiety, delaying gastric emptying, and stimulating glucose-dependent insulin secretion to reduce appetite and improve blood sugar control. The second generation, tirzepatide, Mounjaro/Zepbound, activates both GLP-1 and GIP receptors, providing a dual mechanism that enhances insulin sensitivity, accelerates lipid clearance, and delivers a stronger synergistic feeling of fullness. The third generation, Retatrutide, expands this approach by targeting GLP-1, GIP, and glucagon receptors. Often referred to as the triple G, it not only improves appetite control and insulin function, but also promotes direct hepatic fat oxidation, increases basal energy expenditure, and supports rapid clearing of excess fat from the liver. For decades, medical school textbooks taught us that glucagon was simply insulin's annoying evil twin, the hormone your pancreas secretes to dump stored sugar into your blood when you're starving. It was viewed as a metabolic liability in diabetes management. Turns out medical and nutritional dogma got it backwards yet again. When you bind a glucagon agonist alongside GLP-1 and GIP into a single elegant polypeptide backbone, as engineered in Retatrutide, you unlock an entirely different physiological gear. Glucagon receptors populate the liver and adipose tissue, driving direct hepatic fat oxidation and firing up your mitochondria to generate heat. Instead of just starving your appetite, the Gen 1 approach, a triple agonist actively commands your body to burn stored fat at a cellular level, ramping up basal energy expenditure even while you rest. It doesn't just turn down the thermostat, it opens the windows, stokes the furnace, and throws out the accumulated garbage. For a deeper dive into how these tools fit into a broader optimization framework, check out our insights on the best weight loss peptides. Instead of just starving your appetite, the Gen 1 approach, a triple agonist actively commands your body to burn stored fat at a cellular level, ramping up basal energy expenditure even while you rest. It doesn't just turn down the thermostat, it opens the windows, stokes the furnace, and throws out the accumulated garbage. For a deeper dive into how these tools fit into a broader optimization framework, check out our insights on the best weight loss peptides. If you still think this is just about losing 30 pounds of water and muscle, your blinders are firmly fastened. Let's examine the 5 major systemic superpowers that make next-generation GLP-1s true longevity breakthroughs. 1. The liver flush, MASLD and MASH reversal. If you walk into a standard gastroenterology clinic with a fatty liver, your doctor will likely sigh, tell you to lose weight, and schedule you for a checkup in 12 months while fibrosis quietly marches towards cirrhosis. Contrast that with clinical trials for Retatrutide. In Phase 2 trials focusing on metabolic dysfunction-associated steatotic liver disease, MASLD, formerly known as non-alcoholic fatty liver disease, patients experienced an unprecedented 80% to 100% reduction in intrahepatic lipid content. Let that sink in. We are talking about clearing pathological fat out of the liver at a speed and magnitude magnitude previously thought pharmacologically impossible without a donor organ transplant. Clearing hepatic fat restores local insulin sensitivity, slashes systemic ApoB synthesis, and dampens chronic systemic inflammation at its primary command center. 2. Neuroprotection and brain anti-inflammation. We keep hearing about type 3 diabetes. The emerging medical consensus that Alzheimer's disease and cognitive decline are fundamentally metabolic disorders driven by cerebral insulin resistance and chronic neuroinflammation. Guess where else GLP-1 receptors are densely distributed? That's right, the brain, specifically the hypothalamus and the hippocampus. When activated, these signaling molecules cross the blood-brain barrier and actively suppress microglial activation, the brain's resident immune cells that go rogue and trigger chronic neuroinflammatory damage. While long-term human outcome data on dementia prevention are still maturing, the cellular mechanism is undeniable. Protecting microvascular networks in the brain guards against the cognitive rust of aging. 3. The dopamine reset. Addiction and impulsivity muted. Here is a fascinating side effect that pharmaceutical marketing departments initially tried to whisper about. Patients on multi-agonists report a sudden, profound quiet in their compulsive mental chatter. It's not just that high-carbohydrate, hyperpalatable processed food suddenly loses its seductive appeal. Patients notice they have lost interest in alcohol, nicotine, impulse online shopping, and even nail biting. Why? Because these receptors populate the ventral tegmental area, VTA, and the nucleus accumbens, the core pleasure and reward hubs of the central nervous system. By dampening aberrant dopamine signaling loops, these peptides essentially mute low-grade addiction feedback loops, giving patients their executive functioning back from the clutches of modern hyperstimuli. 4. Cardiovascular renewal and endothelial health. Mainstream cardiologists spent decades prescribing statins to lower cholesterol while completely ignoring the roaring fire of vascular inflammation. Data across advanced incretin trials demonstrate dramatic, consistent drops in high-sensitivity C-reactive protein, HSCRP, improved systolic blood pressure, and restored arterial elasticity. More importantly, these cardiovascular risk reductions occur independently of total weight loss. This is not merely a consequence of being lighter on your feet, it is a direct anti-inflammatory and endothelial repair mechanism at the vascular wall. 5. Kidney preservation and glycation defense. High blood sugar is essentially an internal blowtorch. It caramelizes your microvascular networks via advanced glycation end products, AGEs. Next-generation multi-agonists exert a direct protective effect on the renal glomerulus, reducing renal hyperfiltration and oxidative stress. By halting the relentless microvascular wear and tear that eventually lands millions of aging adults on dialysis, these molecules act as biological preservation shields for your internal plumbing. Now, let's take off the rose-colored laboratory goggles and put on our clinical cynicism hat, because where there is a miracle drug, there is a stampede of reckless humans ready to abuse it. If you treat a triple agonist like a magic wand, injecting it once a week while sitting on the couch eating protein-free cardboard and scrolling TikTok, you will become a poster child for biological disaster. The dark side, sarcopenia and GLP-1 face. Let's address the elephant in the clinic. If you lose 20 pounds in a month without lifting heavy things and consuming adequate raw building blocks, your body won't selectively pillage your belly fat. It will also happily consume your muscle tissue. This leads directly to sarcopenia, accelerated age-related muscle wasting, plummeting basal metabolic rates, weak bones, and the hollowed-out gaunt aesthetic, colloquially known as GLP-1 face. Patients drop fat, but they wreck their metabolic machinery in the process. If you've seen some of my other videos, this means losing metabolic reserve. At ARTC, we don't hand out peptides like candy at a Halloween parade. We build intelligent, multi-layered optimization protocols designed for true biological enhancement, short, targeted cycles, utilizing structured 8 to 16-week cycles to clear stubborn visceral fat, reset insulin sensitivity, and break metabolic plateaus without inducing receptor exhaustion or severe muscle catabolism. Anabolic and structural support, pairing peptide therapy with heavy resistance training, leveraging advanced tools like our ARX computerized resistance protocols to stimulate myofibrillar hypertrophy. Aggressive protein optimization, ensuring daily amino acid thresholds are met so your body builds muscle while shedding fat. Intelligent exit strategies, tapering protocols supported by gut microbiome restoration and tissue repair peptides such as BPC-157 to lock in your new metabolic baseline and prevent rebound weight gain. Let's summarize the truth without the sugarcoating. Retatrutide and next-gen multi-agonists are not crutches for the lazy. When utilized with surgical precision, clinical oversight, and an unwavering commitment to muscle preservation, they are arguably the most potent metabolic and longevity intervention tools developed in our lifetimes. But they are only as good as the protocol surrounding them. Blindly injecting powerful signaling molecules without checking your baseline biomarkers, optimizing your protein intake, or engaging in progressive resistance training is the height of biological foolishness. This isn't rocket science, it's basic physiological stewardship. If you are ready to stop guessing with your metabolic health, stop playing roulette with generic fads, and build a precision protocol tailored to your unique biochemistry, come talk to us. Take the first step today. Contact us directly at 9418-065-511 or visit us online at artc.health.